Heart health is critical at every stage of life, but when it comes to children, specialized care can make all the difference. Today we're joined by Dr. Marcus Edegren, pediatric cardiologist at Mercy's Plum Heart Center, to explore this specialty and how your family could benefit from his area of expertise. Dr. Edegren, thanks for being here today.
Absolutely. Thanks for having me.
So tell us, can you start by explaining what a pediatric cardiologist does and how your role differs from other cardiologists?
Sure. A pediatric cardiologist, kind of as its name would suggest, takes care of children with heart disease, heart concerns, heart issues, many of them congenital, which is probably the biggest differentiator from adult cardiology, which takes care of patients 18 and older. A lot of their focus is on coronary artery disease, acquired heart disease, whereas a lot of my focus is on congenital heart disease.
And doctor, what are some of the most common heart conditions or concerns that you see in children?
Probably the most common concern would be things like heart murmurs, clinical problems that develop later in life, many of which really don't have a heart cause, but we rule that out. Things that we see a lot of include holes in the heart, valves that don't work quite right, pumps that aren't working very well, and arrhythmias. So a lot of children have rhythm disorders, and we take care of those.
Yeah, very serious. But how can a parent know if a child needs to see a pediatric cardiologist?
Believe it or not, a lot of patients come just because their primary care doctor picks up on something. A heart murmur is probably the most likely thing that brings a child to us. But then there are other clinical things that parents take their children to doctors for that end up in our office eventually. Things like rhythm problems or feelings of something funny going on inside the chest. Fainting is a big one. And then in babyland, children that just don't thrive, grow, develop, oftentimes have a cardiac cause for that.
What kind of role does family history play, and what should parents be aware of for their children?
That's a great question, and it's huge. There are some things that run in families that should be an automatic referral to our clinic. I get very concerned if I hear a family has someone who's died suddenly, especially young, unexplained. That can often be, rhythm disorder or a myopathy of the heart. There are some valvular concerns that are very rampant within families, and then aortic aneurysms of the chest. Those should be referred over as well.
And what advances in pediatric cardiology have made the biggest difference for young patients and their families?
One thing about getting older is I've got to see a lot of changes, which have all been great. Surgical interventions have really come a long way. There were things that were inoperable when I first started, which now there are very few things that a baby can be born with that we can't make better and somehow. Technologies like echocardiography, we now do fetal echocardiograms, so that has helped prevent a lot of surprises at birth. So we're usually aware of bad heart concerns before a baby's even born, so that appropriate care can be initiated rapidly, and that improves outcomes greatly. And then I think just generalized awareness and increase in the science has helped promote heart health in children.
Yeah, fascinating. Dr. Edegren, thanks for being here today.
Sure thing.